Bishop here from Sport and Spine Rehab with Mike Reinhold from Champion Physical Therapy and Performance in Boston. And we're going to talk about some of the new things that we've been doing with athletes, specifically baseball players, with the new TheraBand CLX. So Mike, what kind of things have you been doing with this?
Well, one of the first things we focus on with the majority of our overhead athletes is they tend to be weak in their posterior cuff and they tend to lose endurance over the course of the season. So we're trying to work on both strength as well as some fatigue resistance with some drills with their upper extremity.
Yeah.
So the good thing about the TheraBand CLX is that we can incorporate one band to provide resistance in multiple planes of motion. So
using upper and lower body.
Exactly. So what we're going to do is we're going to create one drill that's going to be a coordinated type of drill that locks in a little bit of the lumbopelvic area, the lower extremity, the glutes, and then perform an upper extremity exercise. So we get kind of like an entire kinetic chain type approach with one exercise. First thing we're going to do is we're going to start the setup. So what I want to do is I want to get a little bit of control of the lumbopelvic region with a bit of a spiral technique with the CLX. So what we're going to do is I want to have an internal rotation adduction moment at the knee. So I'm going to position the extremity in the position where I want the force to be applied. So in this instance, I want internal rotation adduction.
We're feeding the failure.
Exactly. So we want to kind of facilitate something away from that movement pattern. So we're going to get the exercise to help us stabilize away from that. So what we're going to do with the band, we're going to place it down by the knee. I'm going to take one end of the CLX and I'm going to place it through one of the loops at the other end. Okay? So as we weave that through, we're going to keep the band down by the knee so that way we control the moment at the knee. This is going to create a little bit of a lever arm so that way the entire femur gets involved in the process as well. So again, we want internal rotation adduction, so I'm going to wrap it in this direction and I'm going to try to wrap it upon itself so that way some of the resistance of the band helps to create that torque. So you probably only need about a couple of different laps around the leg. You probably don't need more than 2. And then once we're in this position now, you can see that Bart has to stabilize and prevent the band from pulling him into internal rotation and adduction. So that's going to fire the glutes, that's going to fire stability of the lumbopelvic area while we start performing some upper extremity exercises. Again, we're going to go back to the upper extremity and talk about posterior rotator cuff. So we're going to perform external rotation exercises. So you can do this in various planes. We can do it at 0 degrees, we can do it at 45 degrees or even 90 degrees. But again, the concept here is that it's a resistance exercise for the upper extremity, but at the same time, when you pull the band, it's trying to pull his lumbopelvic area into that disadvantageous position. So he has to stabilize against that, create some stability of the core, and then perform that upper extremity movement.
There's no question you feel this in the posterior cuff, but you absolutely feel a ton in the glute. And it's just a great reactive isometric for that glute.
Okay, so the progression to this would be now, we're going to create a little bit longer of a lever arm, and we're actually going to loop the band around your foot. Okay, so what we're going to do now is we're going to combine some movement with the exercise. So by putting it on the foot, I can now free up a little bit more mobility of his lower extremity and get him to actively contract the glutes to extend the hip. Okay, so we're going to wrap this around his feet, his foot, and then we're going to bring this up into the same type of position for the shoulder. Okay, so we're just going to loop his hand into one of these straps. And again, the good part of using the CLX is that if this is too light, we can just increase one loop down and provide more resistance. If it's too heavy, we can slide in the other direction and provide a quick kind of change of the resistance. So once we're in position here now, we have a very similar stabilization moment with the band at the lower extremity and an exercise at the upper extremity, but what we can do now is we can create a stepping motion. So for my overhead athletes, oftentimes we simulate the stride, and again, stabilization of the lumbopelvic area with glute control, and now what we can even incorporate is a bit of eccentric control. Okay, so bring that leg out for me, Bart, and then in this position here, he stabilizes and slowly lowers down with the band. Okay, so now we have an exercise for resistance as well as eccentric control. Okay, so when his leg's up, he can release the band, kind of create less tension in the shoulder, make it easier, come down, stabilize, pick up some slack, and then slowly lower down over time.
And the other thing is that, like you mentioned with changing these loops, form is critical, right? Everything has to be done in proper form.
Right.
And so once people start to break down, you can change a loop once their form breaks down, you can change a loop, make it one loop longer, have a little bit less intensity, and continue to perform a few more repetitions until their form breaks down again. And then you've maybe gotten to your fatiguing point where you move on to another exercise.
Exactly. Perfect. Now, what about somebody that, maybe we have an overhead athlete that's injured, maybe they have an elbow injury. We want to create a little less stress at the elbow joint. A lot of times when we use an external moment at the arm, we're going to actually provide a valgus toric at the elbow. So we're going to create some stress on the inside of the elbow. So one of the nice things we can do is we can use the spiral technique again to position his arm in internal rotation. And then I'm going to create we're going to go through the loop. And we're going to create an internal rotation moment with this band, okay? So I'm going to wrap around, pull him in internal rotation, up by the humeral head. And now what we've done here is we've created an additional type of resistance that is applied just to the humerus and not through the elbow as a lever. So try that, Bart. And perform the same exercise now, but you can see he has the resistance now more proximal. So there's no stress on the elbow, and he can still get resistance at the shoulder. You still feel that pretty good, right?
No question. Feel it in the glutes, in this lead glute. Feel it in the posterior cuff. Feel it in my scapular stabilizers. It's absolutely.
Great. And then the progression for that, maybe we want to start putting some stress on the elbow. Now again, we can use a completely different resistance level. Attach this to the foot again. Come back up, and now we can incorporate the hand again. So now we can have an open hand position and incorporate both the humeral placement as well as a more distal placement of the hand and combine the two, okay? And meanwhile, the whole time the hand's still free, we can perform some rhythmic stabilizations. He can hold a ball, he can use an oscillation device, lots of different techniques that we can use with the band.
Awesome. Well, thanks, Mike. This has been fantastic.
Yeah, thanks so much.
See you next time.